Our first title is Peterson's Principles of Oral and Maxillofacial Surgery. This is the 4th edition. It is an important reference textbook. It'll be in 2 volumes. It offers comprehensive and authoritative coverage of the contemporary specialty of oral and maxillofacial surgery. The new edition reflects significant changes in this clinical practice and guidelines that have occurred during the recent years. Readers will find clear explanations of the practical applications of surgical principles. There will be a wealth of supporting illustrative material, including atlas-type illustrations to complement the descriptions of specific procedures. So the 4th edition is an exceptional resource that will meet the needs of experienced surgeons as well as residents in clinical practice. It will also serve as a great companion for the preparation of board certifications or recertifications. The 3rd edition was released by the People's Medical Publishing House in 2012, so there should be significant new information in the 4th edition. Our next title is the Illustrated Manual of Orthognathic Surgery. So orthognathic is the jaw. This is the first volume in a multi-volume series. It is the first of its kind to the market on orthognathic surgery. It reviews gains in information and knowledge in the preoperative and postoperative 3D imaging field by using new radiologic protocols in maxillofacial surgery. So it'll also explain outcomes in the clinical procedures as well in this book. The book is establishes the standard techniques of orthognathic jaw and maxillofacial surgery. There are new considerations and insights based on years of experience in this book, and then there is also analysis of clinical activity in this subspecialty. The book is also uniquely structured so that the clinical scenarios are accompanied by graphic representations for better understanding. The graphic representations illustrate the 3-dimensionality of the complex splitting technique of the mandible, where text and radiographs are often insufficient. So this book will be aimed at a wide readership of students and professionals in oral and maxillofacial surgery. Orthodontics, plastic surgeons will also find this helpful. Our next title is Clinical Anesthesia for the Newborn and the Neonate. So clinical anesthesia for the newborn and the neonate covers all aspects of anesthesia in newborns. So neonates under 28 days and premature babies are covered. These patients are highly vulnerable, often very small in size and weight, at very high risk, and have high mortality and morbidity. This book will provide the knowledge that equips the anesthetist with the regional techniques used to provide anesthesia and analgesia, including information about the drugs used, skills in providing neural axial blocks, nerve blocks, covering complications as well. The book also covers pharmacology of drugs used, the effect of the anesthetic drug on the developing body, and the preoperative workup and postoperative care. It includes care and concerns from both surgical and anesthesia aspects. It covers all the common surgical diseases along with rare cases such as oncological concerns, palliative care, ethical concerns, and pain management. The book will bridge the gap in the knowledge of an anesthesiologist between anesthesia for children and adults and newborns, neonates, and preterm babies. Our next title is Prehabilitation for Cancer Surgery. So this book will explore the concept of prehabilitation to great depths using all possible modes of prehabilitation across surgical specialties. Prehabilitation is a unique concept that is becoming more popular day by day. It begins from enhanced recovery after surgery and has found importance in almost all surgeries now. The book is the first to introduce the concept on prehabilitation. It will describe the methods of functional assessment of the patient's schedule for extensive cancer surgery and ways of pre-optimization. It covers the methods of prehabilitation system-wide, and then it provides prehabilitation tools specific for individual oncosurgical subspecialties. This book will be an invaluable resource for practitioners of oncoanesthesia and oncosurgery in optimizing their patients before surgery for best results. It will also be a useful book for the allied disciplines such as nutritionists, physiotherapists, psychiatrists, and oncology nurses. And our next title is Ultrasound in Peripheral Neuroaxial and Perineural Axio-Regional Anesthesia. This is a comprehensive, highly didactic book on ultrasound-guided regional anesthesia. It presents meticulously labeled images, diagrams, and picture-in-picture samples, and includes high-quality vignetted illustrations that are consistent in its style. The ultrasound images, which is very important for a book on ultrasounds, are carefully selected to demonstrate the most clinically relevant situations. More importantly, they will have a real-world appearance, including actual needle paths and desired disposition of injectate during nerve block procedures. And most of the images are from the original database of the author, Dr. Eisenberg. Ultrasound in peripheral neuroaxial and perineural axial regional anesthesia is accompanied by richly illustrated materials on top of the images and videos of state-of-art techniques. It should be of interest to anyone interested in learning or furthering their existing knowledge of teaching ultrasound-guided regional anesthesia. And our next titles in nursing are with Marit, so over to you.
Thanks, Jenny. Worldwide Successful Pediatric Nurse-Led Models of Care is compiled by an editor who is both a professor and a clinical pediatrics at USC and a research lead at the Children's Hospital of Los Angeles. She has published extensively showcasing her vast clinical research and policymaking experience, and her upcoming book will provide its readers with standout examples of nurse-led and nurse-directed pediatric models of care from all over the world. This book is innovative, forward-thinking, and the ideas are easily adaptable to both clinical and community-based settings. This is a welcome addition to faculty and child health graduate programs, as well as beneficial to clinicians in the hospital setting. Next slide, please. A stoma is a small opening in the abdomen which is used to remove body waste. Published in collaboration with the Association of Stoma Care Nurses in the UK, Stoma Care Specialist Nursing provides specialists in the field with a comprehensive guide for care. Chapters follow a schematic outline of knowledge required when caring for patients who are undergoing stoma surgery. This text serves as an excellent resource for all disciplines of healthcare staff caring for such individuals. Suggesting a healthier lifestyle to a patient is a lot easier than actually motivating patients to embrace advice and make changes for the benefit of their health. Nursing, Health Education, and Improving Patient Self-Management is the second edition of a successful publication describing the latest advances in health education and patient self-management. Health promotion is a huge topic for many nurses, and this book departs from the typical concepts, instead examining health as a micro, meso, and at macro level. On the basis of patients' needs, the book describes methods of interventions to promote self-management in detail. This book is written specifically for bachelor and master level nursing and is linked to the CAN-MED competencies of health promoters. Next, please. Rooted in public health principles, hospital-based injury and violence prevention programs provides important information about ensuring safety during patient-centered acute care. Because of the structural and operational diversity within hospitals, standardized guidance has not been easy to find. Topics in the book include the history and development of hospital-based programs and the need and process for developing data-driven and evidence-based injury prevention interventions. Written through the collaboration of a multidisciplinary author team, this book offers helpful guidance for acute care nurses, trauma program managers, hospital administrators, trauma surgeons, hospital-based injury prevention professionals, and local public health professionals that will be universally applicable regardless of setting. Next, please. Filling a gap in literature, Perspectives on Midwifery and Parenthood explores contemporary issues relating to parenthood and midwifery, highlighting the close and unique relationship that midwives enjoy with women and men during their transition to parenthood. The book's chapters cover preparation for parenthood, the parental-fetal tie in pregnancy, perinatal mental health, maternal well-being, infertility, repeated loss, and surrogacy, supporting early parenting following preterm birth, adolescent pregnancy and early parenthood, social challenges in parenthood, including drug and alcohol use in pregnancy, intimate partner violence, migrants in transition to parenthood, fathers transition to parenthood, diversity of family, breastfeeding, and even spirituality during pregnancy. Midwives will find this resource to be helpful in nurturing understanding between caregiver and patient. Over to Madeline.
Thank you. Midwifery and Sexuality is the next book. This is the first open access book on the subject. It integrates sexual health and into the postpartum care plan, addressing sexuality and intimacy from an education perspective instead of just focusing on treating problems, aiming to foster the development of sexual well-being and happy couplehood. Intimacy can be seriously hampered during and after pregnancy due to mutual misunderstanding and fear, and most midwives and related healthcare professionals do not provide guidance on this area, so this book fills that education gap. With 36 authors from 14 countries, this new practical textbook guides healthcare professionals such as midwives, obstetricians, gynecologists, nurses, general practitioners, pelvic floor therapists, and more by offering both basic knowledge and skills on sexual health and well-being. The Manual of Pediatric Cardiac Care covers the most relevant protocols in pediatric cardiac care. The book offers comprehensive, precise, and up-to-date practical tips with specific care protocols to provide the most efficient strategies for high-quality care in pediatric patients with congenital heart disease. It simplifies learning with many tables, flowcharts, and graphs, and includes many specific sections such as management in pediatric cardiac intensive care units, and surgical management of congenital heart disease for a complete but easy to follow overview of treatment concepts in patients with congenital heart disease. The book also includes a unique section with specific clinical pharmacy guidelines presented in a clear and concise manner. The manual is a must-have resource for pediatricians, neonatologists, clinical pharmacy specialists, and all pediatric physicians who interact with patients with heart conditions. The Handbook of Thyroid and Neck Ultrasonography. Unexpectedly discovered thyroid nodules and palpable neck masses present a common clinical problem. Further evaluation with neck ultrasound helps to characterize these lesions and evaluate the risk of malignancy. Based on ultrasound characteristics, these lesions can be better defined using pathologic and other clinical data in order to determine the best management. This practical handbook provides a guide to thyroid and neck ultrasonography patterns that are commonly encountered in clinical practice. Beginning with photographic examples of each of the ultrasound findings, clinical cases will be used to subdivide each feature and illustrate the differential diagnoses of the various types of thyroid and neck lesions. Chapters include bulleted key points for quick reference, as well as suggested readings for further investigation. While several handbooks exist to educate readers about neck and thyroid ultrasonography and about cytopathology, this is a unique work that combines ultrasound and pathology data into a case-based, easy-to-read, and concise format that fits in your pocket, adapting common terminology that is emerging for ultrasound, which will allow readers to employ a standardized approach to evaluating nodules depending on the risk scoring system used. Redesigning the continuum of care for older adults broadens the vision for new care environments for older adults that are designed to be inclusive, progressive, and meet the needs of an aging population. The contents cover a range of long-term care settings to address the needs of a wide audience. Due to the pandemic, rethinking the spatial design of care facilities in order to prepare for future respiratory and contagious pathogens is one of the prime concerns across the globe, while also prioritizing social connectedness and autonomy in care settings. This book contributes to the next generation of knowledge and understanding in this growing field. Chapters cover home and community-based care, facility-based care, memory care, and end-of-life care. This book is an essential resource for researchers, practitioners, educators, policymakers, and students associated with long-term care, home, and healthcare settings. Providing affirming care to transgender and gender diverse youth aids clinicians in supporting and caring for transgender and gender diverse children and adolescents. A recent study using data from 19 states reported that 1.8% of American youth identified as transgender. Many people who are transgender will experience gender dysphoria, the intense emotional distress that's caused by a discrepancy between a person's gender identity and their sex assigned at birth. In this compact volume, the authors discuss the variety of domains involved in addressing gender dysphoria: social, psychological, medical, and legislative advocacy. They provide clear and concise information on the types and timing of gender-affirming medications and surgical interventions, and offer useful suggestions for making clinics inclusive for transgender youth. The book is essential reading for pediatric healthcare professionals and students in these fields, as well as policymakers.
Okay, great. Thank you. And our next title is Management of Dysregulated Immune Response in the Critically Ill. So this is a new textbook published in partnership with the European Society of Intensive Care Medicine. The book explains dysregulated host response, which is a relatively new term introduced by the Sepsis 3 definitions in 2016. This is in contrast to systemic inflammatory response syndrome that had been used for nearly 30 years. So it's dysregulated host response is a fundamentally new concept, which will require some sort of paradigm shift in the way of thinking of critical care physicians. To introduce the book is split into 4 sections. The host immune response is explained, the possible tools for assessment at the bedside, the effects of dysregulated immune response on vital organ functions, and the possible ways of immunomodulation. This is written by a panel of internationally acclaimed experts of the field and should be valuable for all those intensivists and allied professionals working in ICUs. Our next title is Intensive Care Fundamentals. Also, in partnership with the European Society of Intensive Care Medicine, this is a graphical, dense, and concise text describing the fundamental theoretical concepts needed for doctors and other professionals that are new to the field of intensive care medicine. The book serves 2 main purposes. One, as study material for any junior doctor, nurse, or other allied health professional who is pressured for time and wants to quickly learn the essentials. And the second is the utilization of this book as a course volume in intensive care fundamentals. Our next title is Endotoxin-Induced Shock, a multidisciplinary approach in critical care. So this book provides easy consultation and guidance for an understanding and for the clinical management of endotoxin shock. Endotoxic shock results from severe generalized inflammatory response induced by bloodstream infection with gram-negative bacteria. So the book will cover pathophysiology, principles of management, and key messages when it comes to shock. The readers will find tips related to the diagnosis and management of endotoxic shock. They will find a multidisciplinary approach drawing a pathway from endotoxin structure and source, the related physiology of endotoxic shock, and a focus on the clinical management of endotoxemia and extracorporeal removal. This book is written by key opinion leaders in the field and is addressed to healthcare providers working in intensive care and represents a point of reference for intensivists, infectious disease physicians, nephrologists, and critical care nurses. We hear a lot about robotic surgery as a field that is growing rapidly. So recent concepts in minimal access surgery covers recent developments in various aspects of minimal access surgery. So we consider laparoscopic and robotic surgery in this field. It is a fairly new branch of surgery that has advanced tremendously in the last few years. And this is the first volume of a set of books on the recent concepts in this field. The book will provide step-by-step descriptions accompanied by numerous helpful photographs and anatomical drawings. It also includes controversies, and it gives a cumulative opinion on the recent changes developing in minimal access surgery. This is a great book for practitioners and young doctors, as well as residents, trainees, and fellows of surgery and minimal access surgery. And then another popular technique growing is a biportal endoscopic surgery. This is a recent technique and has become popular due to its procedure-related benefits. The technique has gained popularity in Asia, Europe, and Latin America since it can be applied to treat many diseases of the whole spine, cervical, thoracic, lumbar, and sacral. It is the first book on unilateral biportal endoscopic surgery, spine surgery, and it presents the technique history, its current applications, the available technology, and basic principles of the surgery. So anesthesia, position, and the operation room setup. Endoscopic instruments, hydrostatic pressure, intraoperative radiology, as well as anatomical considerations of the basic approaches are also covered here. This is written by the influential groups that perform the method and would certainly be widely accepted by all surgeons interested in improving their daily practice. All right, and now over to Mari.
Thanks, Jenny. Osteoporosis in Clinical Practice is a quick reference guide that equips the reader with easy-to-follow guidelines for lifelong maintenance of skeletal structure and function, with an emphasis on diagnosis, therapy, and prevention. This practical guide is aimed at raising awareness and educating physicians across disciplines about this preventable, treatable, and even curable disease. The text covers bone biology, pathophysiology, secondary and drug-induced osteoporosis, as well as risk factors, diagnostic measurements, treatment, and monitoring strategies, new drugs, management of osteoporotic fractures, and much more. Next, please. A concise and to-the-point resource for postgraduates preparing for their fellowship, board, or similar exams, Rhinology Review presents the full range of topics in the modern rhinology syllabus, from basic sciences of rhinology and investigative rhinology through rhinologic symptoms and diseases. To office procedures and operations. Here, each chapter distills key factors into bullet points, which are usefully supplemented by diagrams, charts, illustrative radiographs, and endoscopic pictures. Next, please. Genitourinary and adrenal gland synoptic reporting provides current management strategies with an emphasis on which synoptic elements are used to guide treatment. Written in a user-friendly style, chapters utilize a structured outline format, tables, and include extensive photomicrograph samples throughout. All all genitourinary and adrenal organs are included, covering common large organs such as the prostate, as well as less frequently encountered and much more poorly described organs such as the penis and scrotum. This book will be of great value to pathologists in a wide range of experience. That's it from me. Back to Madeline.
Thank you. Next, we have Pediatric Surgery. This is a second edition following a very successful first edition. The comprehensive book provides detailed practical advice on the diagnosis and surgical management of congenital and acquired conditions in infants and children. The new edition has been fully updated to reflect the major developments in the field of the past decade. Advances in prenatal diagnosis, imaging, anesthesia, and intensive care, as well as the introduction of new surgical techniques, including minimally invasive surgery and robotic technology, are now discussed in the book. In addition, new chapters have been added on surgical safety in children, surgical problems of children with disabilities, and surgical implications of HIV infection in children, among others. This is a well-structured and richly illustrated guide aimed at trainees, young pediatric surgeons, and general surgeons with an interest in pediatric surgery. The book also serves as a handy, quick, and easy reference for those making decisions in daily practice. Aesthetic surgery of the buttock. In the past 5 years, buttock surgery has been changing and expanding worldwide, while also attracting media attention. Surgeons have been confronted with a shocking number of requests for augmentation surgeries. Further, as patients become more complex procedures are called for, such as fat infiltration surgery combined with implants, or, for example, modifying the waist-to-hip ratio. This is the first book of its kind covering all relevant aesthetic issues. It offers essential guidance on performing surgery, but also on avoiding dangerous complications. It also discusses implants, which are an excellent option for many patients. Given its scope, this book presents an invaluable asset for all plastic surgeons around the globe who perform body contouring surgeries. Veteran and Military Mental Health addresses mental health treatment for veterans and active military personnel. In addition to examining foundational practices in the subfield, it contains specifically tailored content concerning the recent collapse of the US-installed Afghanistan government. The book is conscious of the complex emotions that veterans who fought for the past 20 years may be experiencing in regards to these political developments. Organized into 4 parts, the book begins with the foundations of veteran and military mental health culture as patients transition from active duty to veteran status, understand the present stigma and barriers to care, and reflect on their deployment experience. Part 2 delves into the specifics of the healthcare system in which military personnel find themselves at various points in their career, including deployment and returning home. Following this, chapters examine the unique conditions veterans face, such as sleep disorders, traumatic brain injury, homelessness, substance abuse, and sexual trauma. The book closes with discussions on veterans and their families that focus on the effects of deployment on a military person's loved ones and their mental state upon returning home. Timely, socially conscious, and comprehensive clinical manual on veteran and military mental health is an invaluable resource for mental health professionals receiving new military personnel patients and those who have seen a significant shift in their patients due to recent political events. The SAGES Manual Operating Through the Endoscope. The first edition of this book was published in 2016, representing a review of cutting-edge new technologies that are being introduced within the field of flexible endoscopy. Since then, there has been a significant expansion of new technologies and procedures within this discipline that have meaningfully changed this entire subspecialty, and it has become a more standard technique that many trainees and practitioners are looking for resources on to improve their knowledge and technical skill sets. Endoscopic surgery procedures allow for less invasive access for performing increasingly complex procedures. This results in maximal benefit for patients with fewer complications, faster recovery, and less pain. This updated edition will include a comprehensive approach to the diverse applications of this surgical technique, extensive endoscopic images and illustrations, and updates on most topics in the previous manual, as well as a review of exciting new fields of advancing imaging, artificial intelligence, and augmented imaging, and applications of robotics in endoscopy.
And Springer has a long-standing relationship with SAGES and this as a society. So here's a collection of our titles in partnership with SAGES, if you'll take a look.
Great. And then finally, we have Technology for Environmentally Friendly Livestock Production. This volume compiles state-of-the-art scientific knowledge on the technologies that are used to quantify and reduce the environmental impact of livestock production in the cattle, pig, and poultry industries. It makes a serious statement about how such technology can contribute to the sustainability of the livestock industry in the future. As the global livestock sector is growing, modern farm animal production is increasingly regarded as a source of solid, liquid, gaseous, and dust emissions, which can be both nuisance and environmentally harmful. In light of hardening regulations and social pressure, there is an increasing interest in scientific research on air pollution and emissions from livestock operations. This book focuses on methodology improvement, renewable energy sources, nutritional approaches to reduce methane emissions, and technical options for manure management. By sharing good practices, this book is a valuable resource for a diverse readership. Experts across the veterinary and animal sciences, agriculture, engineering, the food industry, and sustainability research will benefit from the findings.
Okay, and thank you so much for joining us to present our Q1 2023 titles. If you have any questions, feel free to contact the trade sales team at Springer Nature. We have our information up on the screen. Take care.